Welcome to the lesson on self-care heals jaw pain. As Professor Payne noted, these lessons focus on those steps that you can do immediately to begin the healing process. Research has found that many self-care strategies can help you do this. For both chronic pain and mild to moderate acute injuries, self-care heals routine will begin the healing process and relieve your pain sooner. You should begin this now. HEALS protocol stands for H for heat, cold, and massage, E for exercise, including stretching, strengthening, and normal functioning, A for analgesics, including anti-inflammatory, pain-relieving medications. L is for lifestyle, focusing on diet and sleep. S is for strain and stress reduction. So let's review each one. First, H is for heat, cold, and massage. This encourages relief and healing of the muscles and joints. With heat packs, use moist heat, put it in a microwave, not too hot, and then just apply it directly to your face. You could also use cold packs. This reduces swelling and does provide counter-stimulation also. Or you can just alternate heating and colding. Whatever feels best is good for you. Then also practice gentle relaxation massage by placing your hands on your fingers and just press down against the jaw to relax the muscles. In addition to a gentle relaxation massage, you should do a deep muscle massage within the trigger points. The trigger points are tender points within a knot of muscle that are sore. You can use your thumb or finger or even a knobble, as shown here in the picture, to press on the knot. Rub this point firmly for a few minutes for a deep massage. This desensitizes the muscle and helps break up the trigger point. And then gently stretch the muscle also. Now, E is for exercise. Exercise will improve range of motion, normal movement and functioning, as well as improve relaxation and posture of the jaw. There are three types of exercise: stretching, strengthening, and normal functioning. Stretching increases your range of motion to normal by gently stretching from 2 fingers to 2 knuckles to 3 fingers between the teeth. Push it to the point of pain and not beyond. And practice this for a count to 10 and do it 4 or 5 times a day. Strengthening will also improve function of the jaw. Push the jaw on each side with your finger without moving the jaw, and also push it back by pressing on your chin. And then normal functioning of the jaw. In this exercise, open and close the jaw slightly and repeatedly without noise or clicking. Keep the tongue up if you can, and just repeat this 10 times, and again, multiple times throughout the day. Now, E is for exercise. Exercise will improve range of motion, normal movement and functioning, as well as improve relaxation and posture of the jaw. There are three types of exercise: stretching, strengthening, and normal functioning. Stretching increases your range of motion to normal by gently stretching from 2 fingers to 2 knuckles to 3 fingers between the teeth. Push it to the point of pain and not beyond. And practice this for a count to 10 and do it 4 or 5 times a day. Strengthening will also improve function of the jaw. Push the jaw on each side with your finger without moving the jaw, and also push it back by pressing on your chin. And then normal functioning of the jaw. In this exercise, open and close the jaw slightly and repeatedly without noise or clicking. Keep the tongue up if you can, and just repeat this 10 times, and again, multiple times throughout the day. A is for analgesics. The best analgesics to use for musculoskeletal pain is anti-inflammatories, or NSAIDs. They can reduce pain and inflammation quite effectively. Some of the examples of these analgesics include ibuprofen, aspirin, naproxen, and even placing topical analgesics on the skin will help alleviate the pain. Use this regularly for several days. It'll work quite well. Now the question comes up about, should I use opioids for my pain? We recommend avoiding opioid narcotic medications since there are a lot of concerns expressed about the safety of long-term opioid administration. As you'd expect, it can lead to adverse events, increased pain and tolerance to the analgesic effect, addiction, and even drug diversion. Most current pain guidelines do not recommend the use of opioids for chronic non-cancer pain, and they reflect the concern over these problems. Some people are on opioids or have expressed interest in considering opioids for the pain. It is important to note that opioids are strong painkillers. In one study, 42% of workers with neck and back pain received opioids at their first visit. However, 38% of them were still on opioids at 1 year and still had pain. In addition, systematic reviews of clinical trials have showed that opioids, when compared to anti-inflammatory medications, have similar efficacy. Yet the opioids have higher side effect profile than anti-inflammatories. It's best to stay away from opioids. Here are some of the side effects of opioid medications. As you can see, opioids had a much higher side effect profile than placebos. They had more adverse events. They had adverse events upon withdrawal, lack of efficacy, dry mouth, nausea, constipation, itching or pruritus, dizziness, drowsiness, and vomiting. Here's the big concern about opioids. Is addiction a problem? In the past few years, opioid use and the death rate from opioids have increased dramatically. Here are some of the numbers. Drug overdose deaths, 40,000. Unintentional overdose deaths, 15,000. Non-medical use of prescriptions, 12 million. Cost to insurers, 72 billion. Emergency room visits, 500,000, and total workers' compensation costs is about 15 to 20% because of the adverse events. The next letter in the acronym is L for lifestyle. It's important to eat and sleep well in order to minimize pain. With regard to diet, it's important to eat a healthy and pain-free diet. Try to avoid sugar, caffeine, hard and chewy foods. And use lots of fruits and vegetables. They include antioxidants, vitamin C and E. You may need to steam them with jaw problems, or perhaps put them in a smoothie. And then also get adequate protein with fish, eggs, poultry, and cheese. This will help encourage healing and repair the muscles and joints. L for lifestyle also means getting a good night's sleep every night. This will encourage healing and relaxation of the muscles and joints. Here are some suggestions on doing that. Make sure your room is dark, quiet, and cool. You'll sleep better. And make sure your mattress and pillow is comfortable and medium firm, and the pillow supports your head without pressing on the jaw. And then get plenty of exercise and no naps during the day. This will make sure you're tired when you go to bed. And then practice calming before bed. Try to avoid exciting books or television shows before bed. And natural sleep aids occasionally can be helpful, but do not do them on a daily basis. The last letter of HEALS is S for strain and stress reduced. Reduce repeated tensing habits that put strain on the muscles and joints. Here are some examples of habits that are common among patients with jaw problems: clenching and grinding of the teeth, or biting hard and heavy chewing, pressing the tongue forward against the teeth, or bracing and thrusting your jaw forward, cheek and lip biting, biting on pens, pencils, and objects during the day, or tense, rigid postures will all lead to repeated strain on the muscles and joints and increased pain. Try to reduce these. Strain can also occur from poor posture. Try to maintain a balanced, relaxed posture for the jaw, head, and neck. With regard to the jaw, use the acronym TATTOO, teeth apart and tongue up in the end position. And then allow the jaw to be in a balanced, relaxed posture. When it's not in use, let the muscles and joints relax. Act as if it's a hammock hanging between two joints. You will also want to reduce the strain during dental care. Dental treatments and tooth extractions often cause jaw strain, and increases jaw pain. So during dental care, make sure your dentist protects the jaw. Avoid long dental visits and avoid opening too wide or for too long a period of time. Try to avoid bite blocks that force the jaw open and take breaks during dental care. In addition to reducing direct strain to the muscles and joints, it's important to reduce overall stress. You need to learn to cope with resilience to stressful events. You kind of got to go with the flow. And then reduce muscle tensing when you're under stress. Take a deep breath and practice calming. And then finally shift from negative emotions. First of all, be mindful of your emotions throughout the day. Take a quick pause to determine them. And then shift to positive emotions through creative actions. These are all reviewed within other lessons. It is important to realize that self-care does heal pain. So follow these self-care guidelines. Try to follow them on a daily routine. You'll notice that pain will improve gradually, but will fluctuate up and down. It'll get worse and it'll get better, but gradually improve. And make sure you identify and reduce risk factors and boost those protective factors and actions in the 7 rounds to improve long-term healing. You can learn all of this from the lessons ahead.